The unkindest cut of all. When the headlines scream about a possible government shutdown, it's easy to miss what's really going on. A slow dismantling of the Affordable Care Act that could cost millions their health care. Obamacare cut the uninsured from 44.4 million in 2013 to 26.7 million in 2016. Now, under the cover of budget fights and muted rhetoric, Republicans have chipped away at the law's protections. The net effect: more than 20 million Americans face higher insurance premiums next year, and almost 14 million could lose coverage over the next decade, an estimated 3.3 million in 2026 alone. That would erase more than 70% of the gains in coverage since the law took effect. The rollback hasn't been loud. After a 2016 campaign that promised to abolish the law, party leaders have largely stopped mentioning the Affordable Care Act by name. But action has replaced rhetoric. Over the past 9 months, changes tucked into the mammoth tax and spending bill known inside Washington as the One Big Beautiful Bill have begun to bite. Among them is a work requirement for able-bodied adults on Medicaid. The Congressional Budget Office estimates that over the next 10 years, that single provision will strip coverage from 5.3 million people. Many of them caught between unstable jobs, patchy childcare, and a maze of administrative paperwork they can't afford to navigate. Another less visible but critical change concerns a tax credit for people earning under $150,000 who buy insurance on the ACA exchanges. Passed during the Biden administration, the enhancement cut premiums for lower-income Americans and capped premiums for those earning roughly $60,000 to $150,000 at 8.5% of income. Enrollment surged. More than 19 million people now receive that tax break, up from 10 million before the enhancement. Republicans chose not to extend the tax break in the recent budget package. Without intervention, the credit will expire at year's end, a shift that could account for more than a quarter of the projected loss in coverage and send premium bills soaring for millions. For people struggling to keep a roof over their heads or to hold together inconsistent work hours, these policy shifts are not abstract numbers. They are the difference between an emergency room visit that won't bankrupt a family and a serious illness that forces parents to choose between medicine and rent. They will likely be central to negotiations if a shutdown forces a fresh round of bargaining on Capitol Hill. The partisan skirmish has obscured an urgent truth. Incremental, technical changes can have sweeping human consequences. As the political theatre intensifies, the story worth watching isn't the soundbite. It's the growing number of Americans for whom health insurance, once secured, is again slipping from reach.